Hey everyone, welcome back to my channel. Today I'm going to be talking about how I take notes in nursing school and how I got through Med-surg. So these are going to be examples of my notes from Med-surg, and I'll show you guys how I did it. And hopefully you can find it helpful in being able to condense all of the information that you get in lecture into short study sheets for easy review. Okay, let's get started. All right, so over here is a stack of papers from one of my exams. So what I do is I take the lecture slides and I rewrite them all on just white printer paper, and I color coordinate the information. So for example, usually an adverse reaction will be in red. Lab data will be in purple. Nursing interventions and responsibilities will be in green. That's just kind of the way I do it. Signs and symptoms might be in pink. What else did I do on here? Sometimes if there's like a fun little fact, I might throw another color in there. Like this was a tip to remember something, so I did that in a light blue. Medications, any type of meds, I always do in orange, and that's across the board, even with pharmacology. It's so much easier to try to remember the medications and the informations when it's color coordinated. And I know that sounds crazy, but there's sometimes that I'll take the test and I'll be like, oh, I remember, it'll be asking about some illness and what we would expect to give for it. And I would remember the sheet of paper, the illness is written in black or whatever color I chose to do it in. Usually they'll be in black or like dark purple or something. And then I'll remember the orange colored drug under it, and it just tricks it right into my memory really fast. So that's just how I do that. Sometimes I draw like little pictures to remember things next to them that probably look crazy, but to me I remember it. So for example, down here I have aplastic anemia, and the big thing our teacher said with that is that it causes hemorrhaging and bleeding. So I put like drops of blood next to it, just like little things like that. So, all right, so I will give you guys an example. Let's see if I'm gonna go in. Okay, so this is talking about blood transfusion reactions. So as I'm going through the slides, the title of the slide might be, acute hemolytic reaction. So because it's an adverse reaction, I put it in red. And then the signs and symptoms are in light pink. If something is a sign or symptom that is specific to that, because let's be honest, you get signs and symptoms for all of these different medical issues, and a lot of them are similar. How many medical issues cause dizziness, nausea, fatigue? They all either cause diarrhea or constipation. Like it's one of the two, and you cannot tell what is going on with the patient just from, oh, they're nauseous and they have constipation. Well, that could be 25 different things. So there needs to be something specific in the question that helps you to correlate it to what it truly is, so then you can pull from that what your nursing intervention will be. So something that is specific to the acute hemolytic reaction is hypotension and lower back pain. So those are the two I have underlined. So when I get a question on the exam that's like a patient getting a blood transfusion all of a sudden presents with 80/60 blood pressure and lower back pain, what do you as the nurse expect? Or maybe what do you do? You can say to yourself, well, this is clearly an acute hemolytic reaction, and then you would know, because you studied, that the nursing interventions for that would be, and to be honest, I don't know these off the top of my head. So, it would be to draw a blood sample, send a urine specimen. Obviously, you would maintain the blood pressure because you want to increase it if they're hypotensive. That's the answer to that one. But when I set it up this way, so here is all the information for the acute hemolytic reaction. It's like a little nugget, right? When it's in the slides, it's like 20 slides. Like sometimes, professors, they might put like 2 words on a slide or 4 words on a slide, and I'm just like flipping through all of these slides. And after you get through, 5 pages with 6 slides on each page, your brain just starts to go, nope, I don't want to study anymore, and you have 100 more pages to get through, it's really difficult. So this kind of makes little study sheets that are really nice, and it helps you to remember the information before writing it down, like because you're writing it down, especially color coordinated. That really helps you to remember the information. But then, so after you write it all, these are your study sheets. This is what you study from. You don't worry about the 100 pages of slides that you have. You know, this is actually, I think, 2 exams. Yeah, so this seems like a lot of pages because these were our exams 4 and 5. So that's why. So typically it would only be like half of this. So you can condense it into like this, which is so nice compared to having, 100 pages of information. So then this is all you use to study. So what I will do is I'll go through it maybe twice, 3 times, maybe twice, and I will, each time that I go through it, the things that I don't remember, I'll mark with little pink Post-its. So then the second time I go through, I will only review the second or third. I mean, it depends. If you go through the first time and you're like, wow, I really don't know this, then go through a second time and do your pink Post-its. Then the third time you go through, only review the pink Post-its. And at this point, after you review the pink Post-its, you should remember most of the information in this packet, and that's when you start your practice questions. So do the practice questions in the book. Pull up, UWorld or Saunders or whatever, and do more practice questions. Davis, I think it's like it's the Success series. They have a Med-surg book, they have a maternity book, they have a pediatric book. Those are great too. Do those practice questions. And you don't have to do a million practice questions. Like sometimes I just get so overwhelmed, like I have thousands of practice questions. You know what I mean? So, but do a good amount till you're starting to, really get them right. The other thing that I discovered at the end of last semester, so I don't have it on these, is the Saunders book is amazing for Med-surg, the Nclex review book. So at the end of the semester for my final, the only thing I studied for my final was the Saunders book. And as I was going through it, I was like, oh my God, there were questions that I got wrong on previous exams that are like, the information is right here in the Saunders book, and it condenses it, and it has some practice problems at the end. So if you have time to do this and then also review the Saunders book, that's really good. However, if you're already feeling overwhelmed with this, you can use the Saunders book to review for the final, because I really think that it does a good job at condensing all the information and focusing on the main points that you need to know. And typically on a final exam, that's the stuff you're going to see, is like the need to know. But I mean, obviously they're wicked hard. We all know that final exams are really hard, but it's a good summary of the information. And if you do this before that, you have really reviewed and seen all the important information, so when you're sitting in front of the exam, you can make the right choice. But don't get down on yourself if you don't make the right choice, because sometimes they're just straight up tricky. They're just so tricky. And sometimes, like specifically maybe in med-surg or maternity or whatever it is, it might be a topic, because nursing is so broad. There's so many different areas of nursing. It could be a topic you're just not into. So, for example, orthopedics. I felt like reading through the orthopedic section of my book was like going to the dentist. Like, I just was like, this is the worst. Like, I just can't. Like, I'm not an orthopedic nurse, I think, to be completely honest. It wasn't my thing. It wasn't my thing. It was a little too monotonous. I'm like, this isn't even exciting. Like, but I'm just saying, in nursing school, you will have exams that you don't do well on. It can be from a variety of factors, whether you just don't enjoy the content, maybe you studied the wrong information, or maybe you just were really sick that day. You just weren't having a good day. But don't get down on yourself. You can definitely come back from one bad grade, definitely. So, I hope that this little review sheet outline showed you guys how to make some notes for med-surg and other classes in nursing, and I hope that it will help you throughout your careers. Please make sure to subscribe below. I am going to be putting out a lot of new videos. I haven't decided how many days it's going to be. I don't know. I'm thinking of doing something like 30 videos in 30 days, or maybe like 30 videos in 60 days or something like that. My brain's still kind of wrapping around it. But definitely feel free to email me. It's mindbodyblossom@gmail.com, and make sure to comment below. I love hearing from you guys. Okay, we'll talk soon. Bye.